Hi, welcome to part 2 of Knee Radiographs for Trauma. In this part, I will go through a method of systematic evaluation of knee radiographs for trauma. It is important to have a method whenever looking at any radiograph. A fracture may be pretty obvious, however, we would try to exclude the presence of a serious injury by looking at subtle signs of that injury on the radiograph. C-gone fracture, tibial plateau fracture, osteochondral injury, fibular neck fracture can be missed if one does not look for them actively, and also look at the patellar position to make sure that there is no patellar dislocation. So this is a normal AP radiograph of the knee, but I will evaluate this in a systematic manner. So there is no obvious fracture. To look for subtle injuries, I will check the articular surface, which is very smooth. An osteochondral defect typically presents along the medial condyle of the femur. The tibial plateaus are intact, but to look for subtle tibial plateau fractures, drop vertical lines down from the borders of the femoral condyles and see what the relationship of the tibia is to these lines. The tibial condyles should lie within these lines or project just outside. If they are projecting well outside, more than 5 millimeters, then suspect a tibial plateau fracture. The intercondylar eminence should be intact. A fracture in this location is indicative of a cruciate ligament injury. Also look at the lateral border of the lateral tibial condyle. This should be sharply defined and smooth. No fragments of bone seen in this area. If you do see a fragment of the bone, that is classic for a C-gone fracture. The fibula head and the neck are intact. Look at this relationship where a part of the fibula head overlaps the lateral tibial condyle. This overlap is important. In the presence of a dislocation between this joint, the fibula tends to migrate and lies laterally. That is the usual presentation of this very uncommon injury. Look also at the position of the patella. The patella should overlap the intercondylar area and the medial femoral condyle. When the patella is dislocated, it tends to lie in a more superior and lateral position, and it is only picked up if one remembers this relationship. Also remember to look for any evidence of stress fractures of the tibia, as well as any fragments of bones which could represent loose bodies. Now let's look at the lateral film. Look at everything again. A fracture that was not obvious on the AP projection may become evident in the lateral projection. So one should carefully examine all the bone contours, check the femur, the femoral condyles, and I would repeat again, that's the medial condyle, that's the lateral condyle. The way to remember this is that the medial condyle projects more posteriorly on the lateral projection. The tibia, the tibial plateau, and they tend to overlap. The fibula head, which is overlapping the proximal tibia, the patella. Look at this. This is the soft tissue shadow of the quadriceps tendon attaching to the superior part of the patella. The soft tissue shadow here is the patellar tendon attaching to the inferior part of the patella and inferiorly to the tibial insertion. So now look at this distance, which should be the length of the patella plus minus 20% of the patellar length. If this distance increases when the patella is in an abnormally high position, this may indicate the rupture of the patellar tendon, and this should be excluded. While evaluating the patella, just superiorly we note that there is a soft tissue band which merges with the soft tissue of the muscles in this region, and this area is the suprapatellar bursa of the knee joint. In cases where the patient develops knee effusion, this would appear abnormally thick. The usual measurement is quoted as 5 millimeters or less. When it is more than 1 centimeter, there is a definite effusion. If it is between 5 millimeters and 1 centimeters, there is a possible effusion. So one should look at this area to look for the signs of knee effusion. Other things to look at again are any loose bodies. Also look for the deep notch sign. Note the lateral femoral condyle. There is a shallow notch in this location. This is usually less than 1.2 millimeters in depth. If the notch is deeper than 1.2 millimeters, appears irregular, then this indicates an anterior cruciate ligament injury. This is an uncommon but a significant sign. So hopefully I have given you a starting point for developing your own method for systematic evaluation of the knee radiographs in trauma. Thanks for watching.